Welcome to week 6, the week 6 of psychological testing class. We are beginning to dive more into serious work now. So we are going to be looking at personality assessment today, objective measures. We are going to be considering 2 major instruments and related inventories. We are going to be looking at the strengths and their pastoral implications. So please pay attention to this and make sure you understand what we are saying. For those of you who have been asking questions about some of the inventories and measures, that's where we are now. So pay attention to it so you can understand what it's all about. Now, personality assessment aims to measure relatively stable patterns of the following. Don't forget, stable pattern of the following. That's what personality assessment is all about. Number 1, thinking. It's measuring the thinking of someone. Personality assessment aims to measure relatively stable pattern of feelings. Okay. Behaviors. Number 3. Behavior or interpersonal style. Those are 4 things it seeks to measure: thinking, feelings, behavior, interpersonal style. Don't forget. All right. So this is very important for you understand that. So objective personality measures are structured, standardized instruments that use fixed response formats. When we talk about fixed response format, we're talking about when you are given a test that has to do with true or false, or Likert. There's something called Likert scale or Likert scale. So that's what we use it for, structured and standardized instruments that use fixed response format, and are statistical scored, and of course they emphasize reliability and validity. Those are the 3 major things that personality measure, it's based on. They differ from projective tests by minimizing subjective interpretation. Okay, they are just different from projective tests. Another one I want to bring to you is the MMPI. This MMPI is called the Minnesota Multiphasic Personality Inventory. Minnesota Multiphasic Personality Inventory. When we talk about this inventory, is one of the most widely researched personality instruments. It's widely used. It was originally developed in 1940s. It was designed to assess psychopathology. When you hear pathology is sickness. When you hear psycho, soul, the sickness of the mind. Right? So there are 3 current versions of this instrument that we have now. 3 current versions. The first one is MMPI-2. MMPI2. You can Google all these things, they are online. MMPI2, that's number one. Number two, we have MMPI2, then RF. MMPI2 RF, and we have MMPIA. That is adolescent version. Okay, MMPIA-A, adolescent version. So that's the current version of Minnesota multiphasic personality inventory. Let's look at the structure. The MMPI includes a validity scale that can detect exaggeration and minimization. Validity scales also can identify inconsistent responding. You give somebody assessment test to do and it's not consistent. Okay, MMPI we identify that, and of course can also assess defensiveness. Okay, beside validity scale, there's clinical scale. This clinical scale can measure depression, anxiety, paranoia, psychopathic deviation, can measure social introversion. Okay, in the clinic, we use it in the clinic to measure those ones. And the strength of this MMPI is that it has strong empirical base. I've told you the meaning of empirical the other time, that it's scientifically based. You can, it can be proven, right? Extensive normative data. It has sophisticated validity scale and useful for clinical diagnosis. The psychologists can use it for the assessment and diagnosis. What are the limitations of this MMPI? One of the limitations of MMPI is that, time consuming and lengthy, right? Time consuming and lengthy. Another thing is may appear pathologizing. May appear pathologizing, may require advanced training for the clinician to interpret. You may need advanced training to be able to interpret it. And there is culturally sensitivity concerns too, right? Like I've told you some time ago, that some of these skills are not made for, the world wide, are made for in some context. So when you are using it for some people from other part of the world, you may have to put some factors into consideration, right? Let's look at another one. We just check MMPI. Let's look at neo-personality inventory, neo-PI, neo-personality inventory. This is grounded in the Big Five. This neo-personality inventory is grounded in Big Five that I mentioned, we talked about last week. It measures 5 domains. Neuroticism, extraversion, openness, agreeableness, conscientiousness. So those are the 5 domains that it's measured. When we look at the structure, each domain is divided into facets for deeper analysis. For example, neuroticism. Okay, neuroticism includes anxiety, hostility, depression, and self-consciousness. All right, they have their facets. They are divided into facets into for deeper analysis. So you can check for the other 4. Just give you one now. You can check for the other 4. The strength of this neo personality inventory is that it's non-pathological focus. It's not focus on, pathologizing. It's not looking at that, and it's widely validated cross-cultural. It can be used with so many people, and of course widely validated, and there's a strong research support for it. Strong research support for it. It's very useful for leadership and vocational assessment. Leadership and vocational assessment for those who are joining leaders, or people who are competing for position or political position or office holders and all that, and who are coming to the ministry can use it for them to really know who they are. The limitation there is that there is a bias of self-report. There's self-report bias, social desirability, influence, and of course, less diagnostic for clinical disorder. Very, very less. Very, very less. Don't forget, you can differentiate between MMPI and neo-PI. Their primary purpose, let me just give you that breakdown. The primary purpose of that for MMPI is psychopathology. You are looking for disorder. You're looking for disease of the soul. But for neo-PI, normal is normal, just checking normal personality traits. That's why they use it in leadership and vocational, right? When you look at the tone, MMPI is clinical in its tone, but neo-PI is descriptive. When you look at the use context, okay, MMPI is using clinical forensic. Yeah, clinical forensic, that's where they use it. Why for neo-PI? We use it in counseling, we use it, organization and all that. When you look at the length, it's longer. For MMPI, it's very longer. It takes time consuming. Why neo-PI is moderate. The last one is validity scale. When you check the validity scales, MMPI is very extensive. Why neo-PI is limited. So the MMPI assesses dysfunctions, while neo-PI assesses personality structure. It's not looking for the trouble or the disorder. It's not looking for pathology. It's only looking for personality structure. What are the related objective inventory? There are others commonly used too. They are 16PF cartel. Last week we talked about 16PF cartel. Personality assessment inventory, PAI. Myers-Briggs indicator, MBTI. These are others that we use. Please, MBTI has a weaker psychometric support, though it's very popular. You can't compare it to others, to MMPI or neo-PI or 16PF, according to Cartel, or PAI, personality assessment inventory, or Myers-Briggs type indicator, MBTI. So those are 5 measuring instruments or apparatus we have to measure personality. But MBTI has a weaker psychometric support. Let's look at the strengths and objective personality measure. The first one is the standardization. Number 2, quantifiable scoring. Number 3, norm reference interpretation. Number 4, strong reliability. Number 5, empirical validation. Empirical validation. The limitation of objective measure is that self-report distortion, cultural bias is there. We've discussed that. Reductionism is another challenge, is another limitation. Over-reliance on numerical scores is another problem. Misuse without proper training, when you just give it to someone to use it without training. Okay, it's a limitation. It can be done that way. Anybody can just lay hands on it and begin to use it without training. That's the limitation. So testing should inform people, not replace, okay, clinical judgment. It's very important. For pastoral implication, in pastoral counseling and ministry, personality assessment must be handled carefully because it's a ministry setting. You must avoid abuse of that. Otherwise, it won't perform the purpose of having it. In using those instruments, we must be ethical. Anything complex training must not be administered without training. The fact that we are talking about in class today does not mean you should go and be using it to measure people or test people. You need to go for further training and get certified before you can begin to use it for people. Okay? So we must maintain confidentiality too. When we use all these things, any information we got must be preserved. And we must avoid labeling people. And the result must be used for guidance, not to judge people. We have to be very, very careful. So, application in ministry. This personality assessment can help us to develop our leadership, solve problems, conflict resolutions, in marital counseling, in team formation, in self-awareness growth. And it's very, very important that we must prioritize dignity over diagnosis, dignity of human being. All right? This is very, very important. So at the end of this week, I expect you to be able to describe MMPI and NeoPI, compare clinical and trait-based assessments, identify strengths and limitations, and evaluate ethical consideration that I just discussed, and apply personality insight responsibly in pastoral context. I hope this will help you in your readings this week. It's not meant to give the detailed explanation. I can't even do that. But this is just to support your readings, to help you understand a bit whatever you are reading, to put flesh on what you are reading. If you have any question, feel free to ask me. But I hope this will be helpful for you in overall. Until I come your way again next week, please enjoy the rest of the week and be blessed. Take care, everyone.